Good afternoon, everybody. Hey there, it's DJ. Um, so today I have kind of a safety training. It shouldn't take very long, but it's one that we've gone over. I've gone over with most of you, but I do want to make sure that everybody gets this information, just so everybody's on the same page, and that we're all staying safe. You know, hence it being a safety training. And that way, also, if you have any questions, things like that, or if your family has any questions or things like that, you can always refer to this or give me a call, to clarify anything. And, I like questions. I like answering them. So, like I said, if any of this seems confusing or you're not sure, or anybody, or what's going to happen in the future, I will either answer it the best myself, or I can at least direct you to who could answer it best. So this is just on, there are some changes starting today on how we're going to go about things for a little while, just with the different variants of the coronavirus or COVID-19. So it's getting a bit worse just with the variants. There's the Delta variant, and then there's also the Lambda variant, which is following up. And basically what happens with most viruses is they mutate, and that's why they call them variants. They mutate to kind of adapt and change as well. And so, it's just kind of evolution, is the evolution of the virus. So what we have to do is make sure, as much as possible, that we're vaccinated. That will help keep us safe. Make sure if you have to get 2 shots, you got both shots. And then, making sure that maybe, if you haven't been tested, it's good to sometimes go in for a test. If you have Kaiser right now, it's free. They might start charging. Hopefully they don't, but they might. So let's go over some of the things that are going to happen. So this goes over basically, it's talking about the Delta variant. It's highly transmissible, much more than the original COVID-19 virus is the Delta. So in Contra Costa County, we're now averaging over 300 positive cases per day, with a rise in hospitalizations and ICU cases. Overwhelming of people that are unvaccinated. So most of us are vaccinated, which is good. But if not, it's definitely something that you want to think about getting done as soon as you possibly can. Let me know if you need any help with that if you haven't been vaccinated, and I can do my best to help find resources and things like that for you to get vaccinated. And it does say here, it says the best way to combat the outbreak is to get vaccinated. So while there have been breakthrough infections of vaccinated people, these folks are now experiencing mild to no symptoms at all. So that means that the vaccine is working. Data shows that 99% of people that are hospitalized in the ICU, intensive care unit, are dying from COVID-19 are unvaccinated. So we are fortunate and thankful to that about 85% of our staff are vaccinated. So that is good news, and let's hope that that continues to rise, and things will get better. But because of this, the directives from the CDC, Centers of Disease Control, State Department of Public Health, Contra Costa Public Health, Community Care Licensing, and the State Department of Developmental Services need to be fully compliant, required by August 23rd. So we're getting started a bit earlier just to make sure that, we're ready to go throughout each of our programs. So what that means, and like I said, I've gone over it with pretty much all of you, but this is what it means for us. Is that masks are required for all indoor public places, including disability. We have been requiring masks at work all along, so really there's no change with that. So we have to keep wearing a mask. It will change a little bit as to what kind of mask you have to wear, sorry. Well, and change, because you should only use certain ones once, and if you do have a cloth mask, you can wear it once, but then you need to make sure you wash it before you wear it again. Number 2, each program must track and verify the vaccination status of all of us, individuals at the program, as well as the staff. We need to track all of that. And so here's something that's new. So all unvaccinated people, including both staff and y'all, must wear either a surgical mask or N95 mask. Vistability, we will provide people with masks. So, I have my mask here. It's cloth. But I can continue to wear it because I'm vaccinated. So if not, I would have to wear an N95 mask. Now, the reason I wear this one, honestly, I don't really mind wearing an N95 mask, except for that my glasses fog up. And when I'm driving, it's not the best thing for my glasses to be fogging up while I'm driving. This is it's to keep my glasses from fogging up. So that's why I wear this mask. I have a bunch of them, but I wash them after each use. So if you're not vaccinated, you have to be wearing an N95 mask. So that's just something for y'all to know. But I think everybody I'm not sure, but I'm pretty sure the majority of the people in our group are vaccinated. Fourthly, we will continue to do monthly surveillance tests of all staff. That's just the swab of the nose. And, and if it comes back positive, then if you're vaccinated, you can come back to work. But you have to be wearing a mask. Now, if you're unvaccinated, then you're required to be tested weekly. So this month, I only need to be tested once because I've been vaccinated. If there's any staff that hasn't been vaccinated, then they need to get tested every single week. And then for the people we transport, we must revert back to 6 feet distancing in our vehicles. Unless people live in the same household, which we don't have anything of that happening in our group. So again, that's why we're going to go back to one person in the van, and we have to be sitting in the back seat. And, that's the change. Okay, and this is the major part. So finally, another change in a response to someone testing positive program, which means either y'all or staff test positive and has been at the program in the previous week. So if somebody tests positive, and most likely this will be staff, but y'all as well, then everyone has to wear an N95 mask for at least 2 weeks, and then all of us need to be tested. If we had any contact with that person, we need to be tested twice. And so that would mean y'all and the staff would need to be tested 2 times, and have that test come back negative in order for us to basically be able to go on outings or anything like that again. So, and then if for some reason, so like I said, if somebody tests positive, say it was me, just plain DJ, say it was me and I tested positive, then you and me, well, I would have to quarantine for 10 days. But then y'all would need to get tested that week. The moment you find out, set up a test as soon as you possibly can, and then set up and get a test for the next week. And then what will happen is, as long as it tests negative, then you can come back. If you can't do that, if you can't do the test, then what you can do is you can quarantine for 10 days. And that means you can't come to program, you won't have contact. I mean, we could still do like Zoom classes and things like that with you, but you wouldn't be able to come into program for 10 days. So those are the changes. Like I said, I mean, it's kind of a lot of information. But if you have any questions, feel free to call me at any time. And I don't mind going over all this with you again. And if anybody in your family has any questions, I don't mind talking to them as well. So, anyway, I will talk to y'all later on. Have a wonderful rest of your day. And I will see you soon. Okay.